Next on the agenda is House File 2116. Representative Frederick, would you like to move your bill and tell us about it?
Yes, thank you, Mr. Chair. I'd like to move 2116 be referred to the Human Services Finance and Policy Committee. I also have an amendment for the bill.
Why don't you go with your A1 ahead with your A1 amendment, Representative Frederick?
Thank you, Mr. Chair. I'd like to move the A1 amendment before the committee. It is a technical update feedback that I was received from DHS, and I would invite DHS to make any comments on it.
Okay, Representative Frederick moves A1 author's amendment to put the bill in the shape you would like it for the bill's first committee hearing. Any questions? Seeing no questions, this is going to be a voice vote. If you could unmute yourselves. All in favor say aye.
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 Opposed? The motion prevails. The amendment is adopted. Representative Frederick, please tell us about your bill.
Thank you, Mr. Chair, members. One of the things that we've heard in this committee over and over again is the need for mental health services, and that we need more providers and we need more. But one of the things that we can do in addition to adding more people into the workforce is give our current providers more time, more face-to-face time with the people that they are serving. One of the ways that we can do this is increase efficiencies and reduce the amount of paperwork that they have to do. The more time that they can have working with people, the more people that they're able to serve. And so that's what this bill does in a nutshell. And I would turn it over to my testifiers at this point. You're muted, Mr. Chair.
Thank you. Thank you, Representative Frederick. We'll go to the first testifier, Mr. John Magnuson. If you could introduce yourself, who you're with, and start your testimony, please.
Thank you, Chair Fisher and members of the committee. My name is John Magnuson. I'm the Executive Director of MARCH, the Minnesota Association of Resources for Recovery and Chemical Health. MARCH is a professional association of addiction and treatment professionals and organizations striving to raise awareness about addiction and the power of recovery. We represent more than 75 agencies and a workforce of more than 5,000 individuals with members in every region of Minnesota. The goal of MARCH is to improve access to quality behavioral health services for all Minnesotans who need support and share the value of long-term recovery to the individual, family, and communities we live in. Our three overriding public policy goals this biennium are increasing access, strengthening the workforce, and creating sustainability. Representative Frederick's paperwork reduction supports all three. In a moment, I'll invite my colleague and longtime MARCH Board of Governor, Dr. Lance Egley, to share the history of this initiative and describe in greater detail how this bill complements the work already underway with DHS on unified service standards. MARCH is proud of our collaborative process of problem solving we've established and tries to work with all stakeholders we share responsibility with on the behavioral health continuum. This same spirit was brought to our work with DHS on paperwork reduction. In fact, we see paperwork reduction as essential in helping us weave together and make seamless the important work already underway on unified service standards. While we have valued and appreciated the professional work of the internal DHS staff, sometimes an outside perspective can identify blind spots and challenges that, when identified and addressed, strengthen a system and allow greater integration of the parts, making a more seamless and effective process improvement. We've got great confidence in the NIATEX model of process improvement, which we feel would bring great value to our collaborative work with DHS. MARCH again appreciates the leadership and work of Representative Frederick on HF2116 and thanks the chair for the time. And if okay with the chair, I'd invite my colleague, Dr. Lance Egley, to unmute and share now.
Okay, thank you, Mr. Magnuson. Dr. Lance Egley, if you'd like to go ahead, introduce yourself and start your testimony, please.
Thank you, Honorable Chairman Fisher and members of the committee. My name is Lance Egley. I'm testifying for MARCH. I have provided direct service for substance use disorder clients, trained other providers, and developed systems over the last 25 years. I have 2 licenses, a PhD, and I completed at University of California, Berkeley, a postdoc in the organization and financing of mental health services. I want to thank Representative Frederick for his straightforward introduction of the purpose of this bill. House File 2116 formalizes a collaborative relationship between the Department of Human Services and substance use disorder providers to reduce paperwork, improve systems, and make regulation more consistent. We plan to update piecemeal requirements and forms that have accumulated over many, many years and decades, resulting in sometimes in unnecessary, duplicative, confusing, or impractical rules. The department's March 2020 report to the legislature recommends this work. Our exhibits show something of the process and possible results. John referred to NIATEX. Compare the marked difference between mental health and substance use disorder regulation, show support from the Mental Health Legislative Network Blue Book, and provide a copy of the DHS report. After several years of long effort centered around getting adequate resources to do this work and getting everybody on the same page, this past September, DHS began voluntary collaboration with March toward this end. Since September, we've had a very slow but consistent, steady increase in committing time and energy. This increased commitment was obtained partly by combining the Uniform Service Standard process that the department has been looking at for many years and already completed with mental health, with the paperwork reduction goal. Although the new voluntary effort is very promising, it has not been able to meet nearly as often as intended initially, and the achievements so far speak largely to capacity building and not yet to the substantive changes needed. To improve capacity further, House File 2116 includes 2 capacity building elements. First, it names 3 specific participants that are not under the direct control of DHS Community Service Division, whose cooperation is necessary for this to succeed. That would be the licensing division of DHS, the Department of Healthcare Administration, which monitors Medicaid for the federal government, and Minutes, the IT division, which is necessary to implement electronic changes. Secondly, it appropriates a concrete money investment based on the amount recommended in the DHS report. This money would fund an outside consultant with experience successfully guiding similar processes in other states and on systems improvement, and it would provide sufficient DHS staff time to do its part of the work properly. If passed, this bill can rationalize and make consistent publicly funded chemical health treatment in Minnesota, free scarce LADC and other treatment staff time throughout Minnesota from paperwork to spend more time working directly with clients, focus and simplify the necessary training, consultation, monitoring, and reinforcement of that's done by the Department of Human Services. It's well documented that paperwork, especially more than 25% of the time away from clients, causes burnout and loss of people early to the field. And actually, Minnesota right now requires more than 25% of the time from direct service people to be diverted from direct service. Other states have also achieved increased client retention, reduced client burden, save the department staff time. On behalf of March, I welcome any questions from the committee, and also we look forward to the opportunity in the future to comment on the amendments.
Thank you, Dr. Egley, for your testimony. Are there any questions that people have for the bill author or for testifiers? Representative Baker, go ahead, sir.
Thank you, Mr. Chair and members. I just wanted to also lend my support to this bill. This is a bill that I've carried in the past. I really appreciate Representative Frederick for bringing this forward. I've worked with Dr. Egley and others on this bill, sort of like I brought, prior to the duplicate licensing bill that I had a week or two ago. This is a serious attempt to try to really take a hard look at where we're wasting time, where we're wasting efforts and energies when we could be spending time with patients and folks in need. So the Paper Reduction Act and this bill concept is super important. And again, bringing in an outsider like Dr. Egley has suggested and we have proven records that these guys do a nice job with this. This is a really good step. So I just want to say I really support this bill. Appreciate you bringing it forward, Representative, and thank you for your great testimony today too, Dr. Egley. Good to see you again. Thank you.
Thank you, Representative Baker, for your input and for your thoughts and support on this issue. Are there any other comments or questions that people may have? Not seeing any hands go up at this point in time, I would like to turn it over to Representative Frederick for any final comments.
I just want to say again, thank you to Representative Baker for those comments too. It's a pretty simple concept that if the more face time we can get providers to be able to provide services, the better off we're going to be. So I appreciate all the member support for this.
Okay, there being no further discussion, Representative Frederick renews his motion that House File 2116 as amended be recommended for referral to the Human Services Finance and Policy Committee. Mr. Cross, please take the roll.
Fisher.
Fisher, aye.
Fisher, aye. Frederick.
Aye.
Frederick, aye. Frankie.
Frankie, aye.
Frankie, aye. Baker.
Baker, aye.
Baker, aye. Becker Finn.
Aye.
Becker Finn, aye. Hanson.
Hanson, aye.
Hanson, aye. Katiza Watoon.
Aye.
Katiza Watoon, aye. Lippert.
Lippert, aye.
Lippert, aye. Moeller.
Aye.
Moeller, aye. Pearson.
Pearson, aye.
Pearson, aye. Thompson. Thompson. All right.
Thompson, aye.
Thompson, aye. Mr. Chair, there are 11 ayes and 0 nays.
There being 11 ayes and 0 nays, the motion prevails. House File 2116 as amended is recommended for referral to the Human Services Finance and Policy Committee. Thank you, Representative Frederick.